Whenever we see a CT scan of the brain, the first question should be not what is pathology. The first question should be where am I in the brain and how am I looking at it. Understanding the orientation and the normal anatomy of an axial CT brain is the foundation for identifying abnormalities such as hemorrhage, infarction, edema, hydrocephalus, and the midline shift. So in this video part 1 we will learn how to orientate ourselves on an axial city brain and identify the major anatomical regions. So let's start. Hello everyone, welcome to MedVision. First, this is an axial city image of the brain. The axial means we are looking at the brain in the horizontal and the transverse plane. Imagine dividing the head into a multiple horizontal slices. Each slice gives a cross-section view of the brain at a particular level. On the CT, we generally see the bone are very bright white. You can see the structures. These are the white layers. This is bony part, and the brain tissue are the different shades of gray. You can see the gray shades in the mid of the brains. These are the our brain tissues, and the CSF and air look like dark. You can see at the mid and the lateral and the medial side the dark shadows are the CSF and the ears we can see in this case. The basically understanding of city density will become very important when we starting the pathology of the upcoming parts. So how to identify the right and left part? Now coming the most important part, the right and the left. Remember that the CT scan image usually displays if we are looking at the patient from patient's feet towards the head. Therefore, the patient's right side appears on the left side on our screen and the patient left side appears on the right side of our screen. This is very common point of confusion for the beginners. So don't simply look at the screen and call the left side left. Always check the orientation markers and remembers patient's right uh, is the left side of the image and the patient's left is the right side of the image. This is became extremely important when the identification of unilateral hemorrhage, infarcts, mass and other abnormality. So this is very important to seeing these things. Next is anterior and posterior. In the axial image, the anterior means towards the front of the patient head and the posterior means towards the back of the patient. So the frontal regions is anterior. This is the frontal region, that is the anterior portion, and that is the backward region, that is posterior portion. So the cerebral region is anterior while the occiput regions of the cerebellum are the posteriorly. Before interpreting any city brain, always establish of two directions, right, left and anterior, posterior. Once your orientation is corrected, the anatomical identifications make much easier. The next is identify the skull and the scalp. Now that starts from outsides and moves inward. So the first structure we can identify the scalp. There is a thick structure. The outside structure is called scalp and the deep to the scalp, the skull and the cranial valves. On the CT scan, the bone appears very bright and very hyperdense. You can see in the image the very bright and very hyperdense, and this is called a skull bone. When evaluating the skull, we can look for fractures, any depressed fragments, abnormal bone density, and other traumatic changes. So, even before looking at the brain tissue, the skull should be assessed. If we moving inward, we come an important midline structure is called phalanx cerebri. You can see the midline. This is the midline. This part is called a phalanx cerebelli. The phalanx cerebelli is the fold of durometers, then separate the right and the left hemispheres. On the axial CT scan, you can see the midline. This structure is particularly useful because it helps to identify the midline of the brain. And why midline is important? Because later, when we look for the conditions such as mass effect or a hemorrhage, we need to determine whether the brain structures have been pushed away from the normal position. So that is what we call the midline shift. So next is interhemispheric fissure. Adjacent to the phalanx or is the interhemispheric fissure. The separation between the left and the right cerebral hemisphere. So you can look at the axial CT. The first identify the central separation. It gives the immediate reference for the right hemisphere, left hemisphere, and the midline. So this is the most easiest landmark to use when you are learning CT brain anatomy. Next, we identify the major lobes and brain lobes. Now let's identify the frontal lobe. Anteriorly, we have the frontal lobes. The frontal lobes are occupied in the front part of the cerebral hemispheres. So these are the part of the frontal lobes. So moving posteriorly, we reach the parietal lobes. These are the area of the parietal lobes which then appear from the right and the lateral and inferiorly we moving identify the temporal lobes and the posteriorly we have the occipital lobes. So simply remember this frontal, parietal, temporal and backward is occipital lobe. Don't worry if you can't identify the exact boundaries perfect at first. At this stage, the goal is to understand the overall regional anatomy. So next important landmark is visible the level of the Salvian feature, also called the lateral sulcus. It separates the frontal lobe at the parietal lobe. So this is the area of the lateral sulcus. And the Salvian feature is an important landmark in CT and MRI and brain imaging. It is also clinically useful when assessing the symmetrical of the cerebral hemisphere and detecting the abnormalities such as edema or the mass effect. So this was the first part of our city brain anatomy series. Today we learn how to orientate an axial city brain and identify the skull, phalanx, cerebelli, and the interhemispheric feature, and the major cerebral lobes and the Salvian feature. But only this is the beginning. In part 2, we will go deeper and identify the lateral ventricle, the third ventricle, the caudal nucleus, the thalamus, and the basal ganglia, the insular cortex, and the choroid plexus, and the cerebellum. If you found this explanation useful, like, share, and subscribe to my division and follow for series part 2.